What is the normal length of time for vaccine development? And why can't we use any of the current vaccines against coronavirus?
So there's no guarantee when we start off making vaccines that we'll actually be successful. There are some diseases for which we've spent over 30 years trying to develop a vaccine and still don't have one. Sometimes the answer is it takes forever. And other times, if we already have a vaccine for a disease and we're just making a kind of Me Too vaccine, something that's a little bit upgraded, a little bit better in some way, it can be a relatively short pathway. Why don't we just use some vaccine that we already have and kind of add on COVID and then we can have a vaccine? We've never had COVID before. We've never had this virus before. And so we don't actually know exactly what is going to be successful in terms of a vaccine that will work. Most vaccines are developed by taking the very specific part, a subparticle of the germ itself. It can't cause disease. It can't make you sick. So we're kind of training the immune system so that when in the future you actually encounter the real germ, your body already knows how to see it and how to respond to it, to train our own immune systems so that when we encounter the germ in the future, we have an army that is ready. And so we start off very slowly at the very beginning when a vaccine is developed in the lab. Ultimately, it needs to be tested on some animals usually, and then it needs to be tested in a small number of humans. And we generally start with healthy young adults. So we're not going to try a new vaccine on people who are quite vulnerable, and we're definitely not going to try it on young children. And very slowly, we increase the number of people that we give a vaccine to, very carefully evaluating them day after day after day for any symptoms that they have whatsoever, as we start to learn whether or not the vaccine is safe, and especially, is it actually creating an immune response?
How have some vaccines been pushed out so quickly? How can we reassure the public about vaccine safety and their long-lasting implications?
I think the first thing to say is there is no guarantee that we are going to be successful in developing a COVID vaccine. The science is going to tell us whether we have vaccines that are going to work and whether they're safe. We have tools. We have scientific tools now that we never had before 10 years ago or even 5 years ago. From the time that this virus was identified in humans to the time when we had the genetic sequence of the virus was a matter of weeks. There are hundreds, thousands of laboratories, scientists, doctors, clinical vaccine trial organizations, governments. Everybody is focused on trying to get a vaccine. We've got many, many candidate vaccines that are coming through the development process. We're looking carefully at every single step along the way and asking ourselves, what can we do to go faster? And we've decided we're going to start the policy process, even though we don't even know what vaccine we're talking about yet. So that as soon as there's a vaccine, we've already done a lot of the baseline work and we can make a decision about this specific vaccine and not start the policy process only at that point. It's kind of like having multiple shots on goal. So you can score more if you have 100 shots on goal compared with if you only took 2 shots on goal. We are looking at every single step and asking ourselves, what can we do to make this go as fast as possible while still being sure around safety?
There's a lot of talk about herd immunity. Can you briefly describe what herd immunity really is? And why can't our own immune systems just fight the virus?
The idea of herd immunity is that a germ can only pass from one person to the next if the next person that it's passed to does not have any protection against the germ. If you're fully protected, you've got a suit of armor on because your immune system knows how to fight the germ that somebody just coughed in your face, you're not going to get infected. And so the idea is that not everybody in the whole community themselves individually has to be immune in order for the whole group to be protected. It's kind of like the idea of surrounding the non-immune people and creating a barrier so that no germs could get in. But different germs require different proportions of the community to be immunized and to be immune. We need about 95% of people in a community to be immune to measles, largely through vaccination or entirely through vaccination to stop it transmitting. And that's different from other germs that really only require about 60 or 70% of people to be immune because they're less infectious.
Why do some vaccines change every year? For example, the flu vaccine. And will the coronavirus vaccine have to change every year?
Some vaccines induce an immune response. They create an immune response in our bodies that lasts a lifetime. Other vaccines induce immune responses that are quite short-lived. And sometimes they're short-lived because the germ itself changes over time. And other times they're short-lived because we haven't probably figured out the best kind of vaccine. The reason that we have to get influenza vaccines on a yearly basis is a different problem. That problem is that the germ itself changes over time, and it changes sufficiently that we need a slightly different vaccine on an annual basis. We don't know whether or not a COVID vaccine is going to be durable in terms of duration. We don't know how long immunity might last, even if we get a COVID vaccine. And we certainly don't know whether that germ is going to change itself over time that would require that the vaccine itself would also have to change.
Finally, who collaborates to make these vaccines? Is it all done under the public eye, or is it all secret without any public knowledge?
The way that a vaccine goes from the early stages of discovery and the early stages of development often involve collaborations between researchers in universities or in government organizations working with the manufacturers who have the expertise on how to manufacture a vaccine at scale. How do you make millions, tens of millions, maybe billions of doses of this vaccine? Even after a vaccine is registered, licensed, and authorized to be used in a country, the evaluation of safety never stops. We continue to monitor safety of all vaccines in an ongoing way, day in, day out. This is just like your car. Every car company has a safety department. We don't say a car has passed the airbag test and we're going to stop looking at it and evaluating it. It's a constant effort to make it ever more safe. And if there's any problem, let's identify it early and let's correct it and let's do better. I think what this COVID pandemic has really taught us all is the power of vaccines. Vaccines are arguably, and I think well recognized, to be the greatest public health prevention tool that we have worldwide. They've saved millions of lives in every country around the world. And this COVID pandemic has taught us how important it is to have vaccines that can protect us against diseases that cause outbreaks. So I really want to emphasize that we have safe and effective vaccines against diseases that do the same thing that we're seeing COVID do, that cause outbreaks, that cause pandemics. Maybe we've taken our eye off the ball a little bit in terms of our appreciation of what vaccines have actually brought to all of us. Here we are now facing a disease that's devastating economies, devastating families, and we're really, really just focused on getting a vaccine that's going to be safe and effective.
Hello world. This video was created to dissipate some of the misinformation about vaccines out there. I hope this also helped reiterate the importance of immunization. I want to thank Professor and Dr. O'Brien for giving us her expert advice, and thank you for watching. Stay safe.